Good afternoon, everyone. My name is Fanny Munkwadeshola, popularly called S Fanny. I'm excited to be on this platform this afternoon, and today we'll be discussing family planning methods, contraceptives. What methods do we have available? How do they work? And we'll also be dispelling myths and misconceptions that you might have had about these contraceptives. So, before we start, I would like all of us, whatever information you have heard about contraceptives, whatever misconception you have heard or rumor, can you share with us so that we can start from there? Thank you. So, to the rumors we have heard about family planning, does FP make a woman fat? No, it doesn't. But if you have the tendency for obesity, it is necessary to ensure your provider knows that. That is why a woman is advised to start your method at a family planning clinic. At the clinic, while taking your biodata, they will check your weight, they will ask for family history to know if the woman has the potential for obesity. When this is understood, there are some methods the woman will not be placed on. Does FP cause infertility? Hell no. By the way, when a woman is dealing with infertility issue, contraceptives are one of the methods they use for the woman to manage her system. It's more like when you are restarting your computer. Contraceptive helps the woman to restart her system so that she can return to a normal cycle. This way, it helps the woman to start her cycle all over again. That means contraceptives, family planning methods do not cause infertility. Do they have 100% assurance? No, but they are almost 100% sure that if you use your method correctly, particularly condom that someone asks, once you use your condom correctly, you are sure you are protected. However, as we go on, by the time we start treating the methods one by one, you will know the rules that go with each of the methods. I've answered that question earlier. It does not block a woman's fallopian tube. However, a woman that has been dealing with infection right from when she's young, she has the potential to have her fallopian tube blocked. That is why we tell every woman, once you have an infection, go to the hospital, get it treated. But family planning, how it works is such that it thickens. Some methods are called barrier methods. Barrier methods will block the entrance of the egg, so it does not allow the spermatozoa to meet the ovum. And once there's no meeting of the egg, fertilization will not take place. What some other methods does is that it thickens the mucus at the entrance of the uterus, such that after sexual intercourse, all the sperm, the spermatozoa do not find their way into the womb enough for fertilization to take place. And another method, how it works, I'm not mentioning the methods because we will treat it one by one. Another method works such that it stays in the center of the womb, such that both the male and the female egg cannot meet. And once there's no meeting, there is no fertilization. So, what methods of family planning do you know? What contraceptive methods do you know? Let's share. Wow, you people are pro here. We have some who know 4, 5. So let's start with condoms. We have the male condom and the female condom. So for the male condom is made out of the latex rubber, just like the rubber for balloon. But I think condom is just a bit thicker than the regular balloon. And what are the rules you have for condoms? It is easy to use. There's no side effects. And for you to start using condom, you don't have to go to a health center to ask how to use it once you know how to use it. The rules of using condom is this: ensure that you buy condoms that are properly stored, not the ones that they put inside tray in the sun all day, because the sun weakens the condom. Don't use oil-based lubricants with condoms because oil can weaken the latex. Don't use your teeth to open a sachet of condom. You can just use your fingers to tear the nylon and it opens freely once you open from the zed edge. So what are the things you get from condom? It offers you dual protection. You're protected from unplanned pregnancy and you're protected for sexually transmitted infections and diseases. For every episode of sexual intercourse, you have to use condom. So for those of you who go 5, 10, 100 rounds, even if you are going 100 rounds, that means you are using 100 condoms. For some people say they wash condom to reuse. It is not safe because while you are washing, you never can tell if you have washed the spermatozoa from inside the condom to outside the condom. While washing, you can also perforate the condom. So it is safer, it is best, it is correctly used when you use one condom per episode. Just like the male condom, the female condom is also a barrier method and it is made out of latex rubber. How does it work? It works exactly like the male condom does. While a man wears the male condom on his penis, a woman inserts a female condom into her vagina. If you go through the picture that I've sent, you see how you open the wrap, and once you open the wrap, what you see is like a tube. The rubber is like a tube. It's bigger than the male condom. There's a soft rubber at the rim and there's a harder rubber inside the condom. So once you press the harder rubber inside the condom, it forms a figure 8. So once you get your figure 8, a woman raises her leg on a stool or she squats. That way her vagina opens up slightly and she uses her hand to insert the female condom. One of the advantages of female condom is that you can use it in anticipation. It can be used in advance. 15 minutes, 20 minutes, 30 minutes in advance, in anticipation that your man is coming. So you can wear it and go about your business within the house so that as soon as your partner comes, you get the show on the road. One other advantage is it allows the woman to take the decision of protection as well. Imagine when you are trying to protect yourself and your man says, oh, sorry, I forgot my condom at home. Let's do flesh to flesh. So as the lady, you can just bring out your female condom and use. So you still have your protection. It can also be used if a man refuses to use a condom. You use it in advance and you enjoy it. It feels as much as usual as the skin to skin will feel. One other rule on condom use: you cannot use two condoms together. You cannot use two male condom. Once the male is wearing the male condom, the female does not need the female condom because once you use the two, friction occurs and the condom can tear. So you use only one per time, either of the partners choose to wear. Next, we go to the hormonal methods. These methods are made from synthetic hormone. If you know well of a woman's cycle, you know that there are some days in a month that a woman is not fertile. In short, most days of the month, a woman is not fertile. But we have just a window space of 5 days that we can get pregnant. So how this hormonal method work is, what is in the system, the body of a woman, on the days that she cannot get pregnant, these are what are introduced to the system to be in the system all round the month. Before a woman can proceed on hormonal method, your weight will be checked. The woman must not have goiter. You know those people that used to have one ball on their neck? A woman that has varicose vein, those that their legs look like yam tuber, that they have veins that are popping out. A woman dealing with high blood pressure, cannot be put on hormonal method. They have to help her till her blood pressure normalizes before she can take a method. Also, before a woman can be put on hormonal method, her age Her age will be taken. If she has had abortion before, what happened? If she had had miscarriages before, what happened? All this will help them to understand how the woman's body works. And then when they understand this, they can advise her on one or two methods that she can use. Daily pills. Some women will tell you, I'm not on a contraceptives, I'm not using family planning. But when you ask them what they use, they tell you, I use combat combination 3, or I'm just taking pills. This is also a method of family planning. It's a pill. So on each sachet you have a month dosage on each sachet. A woman takes a pill daily. How does it work? Every day the woman takes the pill works such that the woman is not fertile. That means if you miss your pill one day and you ovulate that day and you have sex that day, you have a higher risk of getting pregnant. For your pill to work, you must take a pill at least every 24 hours. That is why a lot of time a woman is advised to choose the time she wants to take her pills. Do you want to take it in the mornings, afternoons, or nights? And you know that before you go to bed, you take your pill. Some call it choco choco. Má gbàgbé mi, that's forget me not. Roll me má ṣọ, tie me on your wrapper. Alale nightly, all to ensure that a woman does not forget. We have a method that is suitable for a breastfeeding woman because that method is formed such that it does not interfere with breastfeeding. The woman's supply of milk is normal. And then we have the regular method for all women. Once you start your method on day 1, you follow the arrow on the cycle. Whether or not you're having sex, you must take your pill. Yes, it's a trusted method. So how it works, once you start, you're advised to start on day 1 of your cycle. And all the sachets have like 28 days. The last 7 tablets are for a blood tonic for menstruation. So once you complete your cycle to reach your menstruation day, even if you have a longer day of cycle, you continue with the next sachet till your menstrual flow comes. So if your menstruation comes, you take the blood tonic, and once you finish your menstruation, you start a new sachet. That way, you are continuing on your method. The cycle is non-stop. It's a trusted way once you take it daily, whether or not you have your menstrual flow. So on the days your menstrual flow, so for some of us that have 35-day cycle, 40-day cycle, so you continue with your white tablet till the day your menstruation comes. Now we have the young people glorified contraceptive, post-no, emergency contraceptives. Emergency contraceptives. These are strictly made for emergencies. How do they work? They should be taken as soon as possible after sexual intercourse. So for someone who lives in the same city with your sexual partner, you live within the same street, you're on the same campus, sex is not an emergency. So it's something you know might happen and happen repeatedly. So this method is not advisable for you. The rules for this method is as soon as you complete your sexual intercourse, you take a method. The later you take the method, the lower the effectiveness. So imagine if you take it 24 hours later, it's possible that your eggs, the male and female egg, would have met 10 hours ago. Once fertilization commences, this method would not terminate pregnancy. For this method to work, you use it within 0 to 5 days. You should not take more than a complete dose in a cycle. A cycle is your menses, day 1 of your menses to the eve of the next menses. So you must not take emergency contraceptive beyond a complete dose of 2 tablets in 1 month. And in a whole year of 12 months, you should not take more than 4 complete dosage. So for people that use it every week, every other week, every month, that is drug abuse. That is overuse of drug, and they stand the risk that it will no longer work for them. They will just assume they are being protected, whereas the method is just doing its thing. So pills, back to the normal pills. Pills is not advisable for some of us that are forgetful, because we eventually forget 2 days, 3 days, and get pregnant before we remember our pills. So it is not advisable for somebody who cannot be committed to their drugs. Also, if you miss a method, so let's assume you usually take your pill at 6 p.m. daily, and so you missed your Sunday pill, and you just remember now, this is 4:47 p.m. You just remember that you did not take your Sunday pill, so you take your Sunday pill immediately now, and then by 6 p.m. you take your Monday pill. That means you're taking 2 today. If you miss your pill more than 2 days, you are advised to go back to condom use and do your pregnancy test after 2 weeks, so that you will know if within those 2 days you are not pregnant. So after you are sure you are not pregnant, then you can continue your method. If within the days you missed your period, you didn't have sex 3 days before then and 3 days after then you can just continue as if nothing has happened. So the other question on a nursing mother, can a nursing mother use it? Yes, but there's a particular one designed for nursing mother. If you check the sachet, it has the picture of a nursing woman on it. The difference is that the regular one can interfere with breastfeeding such that your milk supply will reduce. But the normal one designed for a breastfeeding woman does not affect your milk supply. Some people have a regular menstrual cycle. So if you are sure you did not have sex and you did not have an infection, you can go as long as 40 days and then your menses will appear. But if you did not see your menstrual flow for about 6 months and you are sure you're not pregnant, it's advisable you see your gynecologist so that they will know the underlying factor to your amenorrhea. Next method we are looking at is the injectable. It's an injection. It's just like any other injection. It's an hormonal method. So we have the one of 2 months, and the 2 months works for 8 weeks, not 2 calendar months. We have the one of 3 months that works for 12 weeks, not 3 calendar months. We have 1 month, but it's not available, it's not readily available in Nigeria. How this method also works is that it's thickening the mucus and does not allow the eggs to mate or fertilization to take place. In some women, no ovulation till their method stops. It is possible when you are on this method that your menstrual flow will cease. It is possible when on this method that you will not see your menses again until the day your method stops. So a woman that is on this method and her menses usually cease, if she takes it from January, she takes 3, so January till September she's covered, there's a high possibility by October her menstrual flow will start again. For this method, it's possible your menstrual flow increases, it's possible it reduces. For some women, they will only see blood stain once a month. There is no cause for alarm. But once your menstrual flow increases enough that you're fainting, see your doctor. When I say doctor, see your service provider. Most family planning service provider are trained nurse midwives. In your state, we have all of them trained nurse midwives. I think in Lagos, we still have some medical doctors being the family planning providers. But your provider could be a nurse, could be a doctor. This method, like the pills and the injectables, is also hormonal method. We have one rod or 2 rods. The rod is flexible rubber, and what is inside it is the hormone, which slowly releases into the system. One rod method works for 3 years. So once a woman is on the 3-year implant, she goes for 3 years without getting pregnant. And the 2 rods works for 5 years. So the woman is covered for 5 years. If the woman is ready to get pregnant before the 3 years or the 5 years, she's free to go back to the hospital and remove the method. And within 3 to 6 months, she will conceive. Some women will conceive immediately if they remove their method to close to their ovulation. So like every other hormonal method, it may alter your menstrual flow. It may reduce, it may increase, it may stop totally till you stop your method. This is one of the methods that allow you to not return to the hospital for 3 years or 5 years. You know, when you're on injectable, you go back to your hospital every 2 months or 3 months. When you're on pills, you go back to your chemist every month, except if you have bought for a long time use. With implants, you can go away for the 3 years and come back to remove it. For the insertion of implants, there's a dedicated needle used for it. It's usually inserted under the skin of the arm of a woman. So like they pick the skin and place it under the skin, and that is where it stays till when it's time for removal. When they're ready to remove, they just pinch that skin at that spot where it is and remove it. A woman on implants, you can feel it if you touch her arm. Are we enjoying the class? I hope we're all having fun and learning one or two things. While as we go on, if you remember any myth that you have heard about a method that we have not treated, you can drop it in so I can attend to the myth. Don't worry, we will still discuss withdrawal at a stretch. And guys who think withdrawal is safe for them, no, it is not. You're only lucky you did not have sex the day the girl is ovulating. If you do, 9-month certificate is waiting for you. So this method we have here is called IUD. Some call it copper T. You would have heard one or two of your older parents or older aunties talk about coil. This is the method they're majorly referring to. If you notice, it's so tiny in the hand, and that's the size it is inside the womb of a woman. The womb of a woman is not bigger than the palm of your hand. But when you are pregnant, that is when it becomes a big balloon. So how does the IUD works? It sits in the middle of the womb such that the egg of the woman that is coming from the fallopian tube does not meet the egg of the man that is coming from the vagina. Once it's properly placed in the middle, it does not disturb, it does not allow pregnancy to occur. It does not interfere with sexual intercourse. You would have heard some people say, man pinch, it pinches them when they are having sexual intercourse. It's more about their consciousness, because even the rope on the IUD that comes out does not go longer than the hair the woman has at the pubic area. We call it show and bear because you have to check it regularly to be sure that the last rough ride that you had yesterday night has not shifted the IUD. Because if it shifts, a pregnancy will occur and the woman will give birth to the IUD and the baby when the time comes. The IUD can last up to 10 or 12 years. So for a woman who she has been told she cannot use hormonal method because of one reason or the other, she's advised to use IUD. Because IUD does not work with the bloodstream. It does not release anything into the blood system. It just sits in the middle of the womb, does its thing, and go about its business. Some women complain about infection when they are using IUD. With IUD, if you are dirty, you will have series of infection. If you are over neat, some women that pour Dettol in the water, put their hand inside their vagina to douche, you will likely have infection because you are altering the fauna or the pH of the vagina space. So IUD will just be like the passageway for the infection to come in. Apart from that, it is very good, it is very safe. A lot of women even forget they did it because it is so comfortable for them. If the woman wants to get pregnant after 2 years, after 1 year, she's free to go back to the hospital to remove the IUD. So the three methods above are natural methods. These are methods that have been traditionally used from ages. We have the cervical mucor, where a woman checks her cervical mucor every day of the month. And when the mucor is thick and creamy, the woman is not fertile. When it's still slightly thick and just look like regular mucor that comes from the nose, the woman is not fertile. But you see, when you have that clear starch, that stretchy, very clear mucor, and at that point in time the woman is feeling fly by nature and feeling soft, that is when a woman is ovulating, and that is when she is most fertile. I think the body does that fluid so that the fluid allows the egg to flow freely or something, but that is when a woman is most fertile and pregnancy occurs. So what some women do is to check this method regularly to know when they're fertile. Then the next one, we have the cycle bead, where a woman counts the cycles like rosary. She counts it every day. Each day she moves to the next bead. If you notice in the bead, there's a movable rubber. So the woman starts from day 1 and starts moving the cycle bead such that by the time she gets to the white part of the bead, she's most likely to get pregnant. Days before it, she's free. Days after it, she's free. But when she's within the days within the white cycle, she's most fertile. Lactational amenorrhea, so many people will tell you, when I'm breastfeeding, I don't get pregnant. Before it can work, the baby must be less than 6 months. The baby must be breastfeeding exclusively, not I'm expressing breast milk. The baby is breastfeeding mouth to breast, and then the mother's menstrual flow has not returned. Once these three conditions are followed, it can work, but it does not work for everybody. So some women, even though they have all these rules intact, they might still get pregnant. For us to understand the logic of how the pull-out method works, there is need for us to understand how fertilization occurs. Like I've said, a woman has a cycle. So let's use a 28-day cycle for a regular woman. For a woman, say there is S-Fanny and her cycle is 28 days. Our ovulation day is 14 days before our next menstrual flow. So that means if she starts her menses on January 1st, she will likely lay an egg by January 14 or 15. So this is what happens. A man's egg will last 48 hours in a woman, and the woman's egg will last 72 hours in a woman. So during sexual intercourse, by the time you think you're withdrawing, a lot of time people think it is during ejaculation that you release. No. From the moment you start the show, there is egg in all the juices that are coming out of you. So you never can tell. And the egg is formed such that it moves at top speed straight into the woman's fallopian tube. So now imagine if the woman lay egg and her egg is just sitting in the fallopian tube waiting for a big bowl, and then the man who thinks is pulling out just shot the gun at that instant. The egg goes straight to the fallopian tube, meets the egg, the woman's egg, and it comes straight to the womb to implant. So in the case of January 1st to like January 10, 11, that the woman does not have any egg, what happens? Whether or not the man withdraw, there is no female egg waiting for his egg. Some days after ovulation, we said she has ovulated on 14th, so 15th, 16th, by 17th her egg would have died. From the 18th down to the next month on the 11th, the next 11th day on the cycle, the woman does not have any egg that can be fertilized. So whether the man ejaculates or not, no pregnancy will occur. In such cases, when you do withdrawal, you're just denying yourself the opportunity of a full-time fun. So it only works because you did not have sex when the woman was ovulating. So a lot of people who will tell you that it works for them is either they are putting a lot of things into consideration, they are checking out their calendar, doing the calculation to know when they are ovulating, and then they are doing withdrawal method. That way, that is when they can say it works. But if the woman is ovulating and you think you are withdrawing, it doesn't work. Let's see some of you if you can practicalize it, and let's know if it works for you. Don't say I advise you to do so. It is highly possible for a baby to be born with the IUD. Like I said while talking about IUD, let's imagine somebody who has done an IUD. While she had a rough ride, there was a lot of fingering, and she did not check her IUD like the following day to know if it's still placed where it should be. It's possible something like this happens, because once the IUD shifts to the left or to the right, the baby will form, and then the IUD will just stay there till when it's time to give birth, and then the baby and everything will come out. So once a woman is on IUD and she gets pregnant, they will tell her not to bother because everything will come out when the baby arrives. The cycle bead, which is like the rosary, is one of the methods that Catholics use. Catholics will tell you they're not using contraceptives. That's because they're using the natural method. So you calculate your day, cycle bead. So it works like calendar. You're moving the rosary daily to know which day you are in your cycle, and you already know once you are seeing the white day ahead, you either abstain from sex or you use a barrier method. So it's a choice. Some people abstain, but abstinence need the agreement between the man and the woman that, bro, the next 1 week, park your car in the garage. I am not available. So for our knowledge, these are the permanent methods for a male and a female. And how does it work? We've been talking about eggs since. So how the male own is done is that the tube that carries the egg into the semen. Semen is the fluid that you discharge, but the egg in it, you cannot see it with your physical eyes. So the tube that carries egg from the scrotum into the tube out of the penis is cut, such that even though the man will still release, he will have erection, he will release fluid, there will be no eggs inside what is releasing. For it to be effective, the man will be placed on a 6-month barrier method, because you never can tell. Some eggs might have escaped from the scrotum, from where it was cut, to the other side, and such a man will think he's free and still impregnate a woman. For a woman, the fallopian tube is clipped or cut, such that even when she ovulates monthly, the egg will not flow to meet the male egg that would germinate it. And once there is no fertilization, like you plant and it germinates, once there is no fertilization, there will be no baby to give birth to. That's how it works. Mostly young people, whoever is above is already an independent individual and adult, can do it. But I know that in this part of the world, you are not even allowed as a young person. Even an older person will be counseled for long and then be given about 2 weeks at least to go and think about it. When you have made up your mind that that is what you want, you go through a lot of counseling, a lot of legal papers before it can be done, because it is non-reversible. So at this point, we have come to the end of this class. Do we still have any questions that we have not addressed? Let's hear it. And I hope we all had fun, and that so many of us will try better method or not try some methods again. Thank you.